This is Anthony Lupo, and today I will be reading to you Heart Disease Risk Factors, Prevention, and Treatment. Heart disease is a range of conditions that affect your heart's health. Examples of heart disease include heart failure, coronary artery disease, arrhythmias, heart infection, and heart valve disease. Heart disease is one of the leading causes of death in America. With this being said, heart disease will be looked at within this video and PowerPoint presentation. Objectives we will cover today include reviewing signs and symptoms of heart disease, reviewing the risk factors for heart disease, the effects of heart disease, reviewing the ways to diagnose heart disease, and reviewing heart disease prevention. Symptoms of heart disease include chest pain, pain and coldness and numbness of the arms and legs, chest tightness, and pain in the neck or upper abdomen. Shortness of breath can be a factor associated with other problems than heart disease. A sudden onset of shortness of breath associated with chest pain may be an indication of heart-related problems. You may also notice an increase in shortness of breath with heart failure. Chest pain and chest tightness in the arms and legs may also be an indication of a heart attack. Cardiac arrhythmias can be an indication of many heart diseases, to include heart attack, heart failure, and many other heart conditions, such as arterial fibrillation, which may lead to further heart complications. Weight gain can be a sign of heart failure. Many of the risk factors for developing heart disease are modifiable. Modifiable risk factors for heart disease include dietary choices. A smart heart diet of low fat and eating more fruit and vegetables with small amounts of sweets. Choosing not to smoke. Making the choice not to smoke will lower your chance of heart disease. Non-modifiable risk factors for heart disease include age, gender, men are at a higher risk for heart disease, a family history of heart disease, a family history of diabetes or being diabetic. Effects of heart disease on the body: shortness of breath, pain in chest, neck, upper abdomen, tightness in chest, arms, legs, cardiac arrhythmias, rapid weight gain, and cold and numbness in arms and legs, heart failure, heart attack, and shortness of breath. Electronical function of the heart may not be working properly. Symptoms: weight gain and shortness of breath. Effects of heart disease on the heart include decreased function of the heart. This may include the decreasing of the heart's ability to pump blood effectively to the rest of the body. This is called ejection fraction, and this is cause for concern if the number gets too low. The heart cannot effectively pump blood, and the patient may need to have medications, surgery, or other interventions to help the heart effectively pump. Symptoms: cardiac arrhythmias. Pacemakers may be required if the patient's electronical function is affected by heart disease. The patient may need a implant cardiac defibrillator if the patient has arrhythmias as well. Symptom: chest pain. The patient may also need to go for a heart catheterization or get a stent if the patient has a heart attack, or may need to have open heart surgery if they have a blockage in their coronary artery that cannot be fixed with a stent. Symptom: heart attack. Cold and numbness in arms and legs, chest pain, pain in chest, neck, upper abdomen, cardiac arrhythmias. These symptoms will affect the body since the blood flow will not reach these body parts, and the lack of blood flow will cause pain and numbness to each body part. Symptoms: rapid weight gain, heart failure, decreased heart function. The patient with decreased heart function will have anemia or swelling in legs and possibly arms. Electronic cardiogram. An electronic cardiogram records the electronical signals from your heart. The test can pick up abnormal heart rhythms during testing. You are tested for an EKG while you are at rest. You can also get a stress electronic cardiogram. This is performed while exercising. The electronic cardiogram and the stress electronic cardiogram convey how the heart's electronical function is working. Holter monitoring. A Holter monitor is an EKG device you wear to constantly record your heart's rhythm. The Holter monitor is usually worn for 24 to 72 hours. The Holter monitor performed is used to detect heart rhythms, dysfunctions that may have been missed on an electronic cardiogram, as an electronic cardiogram is a snapshot at one time, and the Holter monitor is a continuous recording. The Holter monitor is used to record the heart's electronic function. Echocardiogram. The echocardiogram is a non-invasive exam that uses sound waves to produce a detailed image of the heart structure. The exam reveals information, the heart's beating function, and blood flow. It can also show information on the valves. It is used to diagnose valve problems and problems with blood flow in the heart. Stress test. This test involves using exercise or medication to raise your heart rate. Testing is then performed to take images and tests of the heart to see how the heart responds to exercise or medications induce stress. The test can reveal how the heart responds to exercise and if any parts of the heart have blockage. Cataract catheterization. During a cataract catheterization, a short tube sheath is inserted into a vein or artery in your groin or arm. A catheter is then inserted into the sheath using X-ray images to guide the way through the artery until it reaches your heart. During the cardiac catheterization, dye is injected into the coronary arteries to check for blockages. During the cardiac catheterization, the pressure in your heart chambers can be measured as well. The dye can be seen on an X-ray, which helps your doctor see the blood flow through your heart, blood vessels, and valves to check for problems too. Cardiac computerized tomography, CT scan. During a CT scan, you lie on a table inside the CT machine. Inside the machine that has an X-ray tube inside the machine rotates around your body and collects images of your heart and chest. The images can be used to check for cardiac abnormalities. Cardiac magnetic resonance imaging, MRI. A cardiac MRI uses a magnetic field and computer-generated radio waves to create detailed images of your heart. The images can be used to diagnose cardiac diseases. The characteristics of people that are most likely to get heart disease include the following. Age. Although heart disease can affect anyone at any time, heart disease has been known to affect older adults. Plaque builds up in their arteries over time. Sex. Males are more likely to get heart disease than women. Race and ethnicity. Black, indigenous, and people of color are more likely to have complications from heart disease than white Americans. Heart disease is the leading cause of death in the United States, and risk factors of heart disease death differs by race and ethnicity. Social economical status. It can be expensive to eat healthy. Those people in lower social economical areas may have a harder time with heart disease prevention. Areas with lower economical status do not have the access to more expensive, healthier foods and do have access to less expensive fast foods like McDonald's and Burger King. Here are 3 of my references, and here are my last 2 references. Thank you so much for listening, and have a great day.